What are the causes of worms in poop?
Hello there. In this video, we're going to talk about an uncomfortable but important health topic, the presence of worms in poop. It might sound gross, but it's crucial to know, as it can significantly impact health, especially in children. This phenomenon often indicates a parasitic infection, typically intestinal worms.
What are the main types of worms?
There are three main types of worms that are typically found in human feces. 1. Roundworms, ascariasis. These worms are usually long and thin. They can live in the intestines for up to 2 years and produce eggs that are excreted in feces. 2. Pinworms, enterobiasis. These are tiny, thin worms that are white in color. They're most commonly seen in children and can cause anal itching. 3. Tapeworms, teniasis. These are flat, segmented worms that can grow to impressive lengths within the human gut. Infection usually occurs from eating undercooked or raw meats.
What causes worm infestation?
Worm infestations, also known as helminth infections, are typically caused by poor hygiene practices, exposure to contaminated water, soil, or food, and in some cases, consumption of undercooked meat or fish. Specifically, 1. Pinworms. These worms are typically spread from person to person, often when an infected person scratches the anal area and then touches food, utensils, or other objects. 2. Roundworms. Infections with these worms occur when people ingest their eggs, which are typically found in soil contaminated with human feces. 3. Tapeworms. Infections with these worms occur when people consume undercooked or raw meats or fish that contain tapeworm larvae.
How can we prevent worm infestations?
To prevent worm infestations, the following practices are recommended. 1. Maintain good hygiene. This includes washing hands regularly, especially before eating and after using the bathroom. 2. Use safe water for drinking, cooking, and personal hygiene to prevent ingestion of parasite eggs. 3. Cook food thoroughly, especially meats and fish, to kill any parasites that might be present. 4. Wear shoes outdoors, especially in areas where there might be contaminated soil. 5. Regular deworming, especially for children in areas where worm infections are common. The presence of worms in poop is a clear sign of a parasitic infection, usually due to roundworms, pinworms, or tapeworms. While this might seem alarming, remember that these infections are treatable and often preventable through good hygiene practices and proper food preparation. If you or your loved ones observe worms in your feces, make sure to seek medical advice immediately. We hope this video has been informative and helpful. Stay healthy.